Hi, my name is Lynn Charles, and I'm here with 4pointe. I am again doing this series of interviews with students, dancers, teachers, professionals about point work, point shoes, experiences, good and bad with point, and just lots of information and tidbits about point and point work. And today I'm here with lovely Maddie. So Maddie, tell us something about yourself.
Hi, I'm Madeline White, and this is my mom, Suzanne, and I'm 19 years old and I'm from Arizona.
So Maddie, tell me, when and where did you first start point work?
I started when I just turned 12,
Okay.
so I had to take
In Arizona?
yes, in Arizona,
She had to take
a point exam.
like in the studio where you can show that you're strong enough, and she had to get approved by a podiatrist. They looked at her growth plates and all of her joints and things in her foot, and then she actually did another written exam
To make sure you understood the terminology before you went on point.
Well, that's very smart. And so how was your first experience? Do you consider it to be a positive experience, negative, happy, sad, exciting, confusing? What were your feelings about your first days or weeks working on point?
I think it was very positive. I was so excited to start since, you always wonder, how does it feel? Does it hurt or not? But I was the only one that went up on point. So it wasn't with a group of other people. So I kind of feel like I went very quick. Like
Uh-huh.
I started at the bar, of course, but I did things in the center probably a little bit too quickly.
That seems to be the census among most people I talk to. Did you have what were your thoughts in the beginning while she was going on point? Were you nervous for her? Did you feel it's interesting?
Well, I mean, I was very happy and excited for her. It's, a huge milestone, and I was a little nervous when she had to go out and center for the first time, and I never danced on point, so I don't know how it feels like. But I was really proud of her because she never had like hesitation. She just, kind of went after it, and I mean, you always have a little bit of nerves.
Yeah, the point shoe fitting was interesting because of the shape of my foot. I tried so many on, but they kept like it was too big in the arch because of where my arch is on my foot. So it's kind of interesting.
Yeah, I feel like maybe her first shoe wasn't the best shoe for her and her feet, but we only had what the fitter had in her inventory to work with.
Okay, well, I'll get back to shoes in a minute. I think for me, especially with you, one of the most important things that I would like to talk about is your injury.
Yes.
Because for me, it's really important for people to understand how it is to come back after an injury, how emotional it is, how scary it is, how sometimes one gets so depressed and thinks it's never going to happen, I'm never going to get better. And these are all extremely natural feelings. So I would just like you, if you could talk a little bit about your injury, what you had, and how it was to come back.
Yeah, so I had so when I fractured my foot, I was jumping and I landed and it made a pop noise. So I went to the doctor and they thought it was just a midfoot sprain. They did, and they said, okay, well, you go to PT and it should heal. And so then I was cleared by a PT to continue dancing, and I ended up doing a nutcracker, and then I was like, this isn't right. So then I went to a podiatrist, and then they were like, okay, well, let's see what how bad, like if you have like the ligament damage. And so then she ended up ordering an MRI, and then I had like a Liz Frank would you call that sprain?
Midfoot sprain.
Midfoot sprain. And then she said, well, and your second metatarsal is fractured, not completely, but so I wore a boot for 6 weeks. And then I ended up transferring to a different PT that's very good for ballet dancers. And so then I rehabbed, and then I started dancing again, and then I was still having pain in that area. So then he was like, okay, well, let's get a second opinion. So then I ended up going to a doctor, and he ordered a CT scan because at that point I was told it was healed, and then I went to him, and then it ended up being on the bottom of my foot. So the picture of the CT scan is very interesting because it's from the bottom. So normally it's on the top if you're going to fracture your metatarsal. So then we tried things to heal it because he's like, well, it's not healed because you couldn't see it on an MRI because it was on the bottom. So then I tried shockwave therapy to see if that would heal like it by having micro injuries. And then it wasn't healing. So then he was like, I ended up having a surgery done on it at that point. So it was a big procedure. So I had to have stem cells taken out of my hip and then a small bone from my knee. And then they put that in there with a screw, but then it ended up healing. It was just a very long process.
How long
I had
was
to be
it in total?
Well, I think they tried to, so you injured it in
2019 of November.
And they went through however many, like a couple months of PT, and we thought she was rehab or she was healed, and then discovered that she wasn't. And so then we tried some things like the shockwave therapy and some other things to see if we could stimulate blood flow to the area of the non-union fracture. And then she had surgery. So that was like all of 2020.
Yeah, in September I had the surgery. So I was in a cast for 6 weeks, and then I was in a boot with crutches for 3 weeks, and then just the boot for 3 weeks
after the surgery.
And then I could start PT.
Yeah.
So I lost so much muscle. So I was basically starting from zero.
And I think one of the things that was really hard for her was her doctor was like, we would ask, how long is it going to take for her to be able to dance again? Meaning like what she used to be able to do. And the doctor, I think, like gave her a date, but Maddie didn't realize that meant like you'd be able to start like dancing and you'd be cleared along the way.
Yeah, moving again.
Yeah, and it actually probably took her until like May. Yeah, April, May to really be able to do some point work.
Yeah, I was doing so at my PT. Once I started point work, I did it in this thing called an Ultra G, which is like a zero gravity treadmill. And so they wouldn't turn it on, but you go in and it like chooses a percentage of weight. So basically it was like 50% of my weight. So I wasn't feeling it. So it would help a little bit.
And then eventually she was cleared to dance in the studio. And, she was just doing little bits and pieces. And then shortly after that, we connected with you.
Yes, thanks. I'm very thankful for you.
Well, we'll get to that in a minute. So it's amazing that you were able to go through all of this. I mean, sometimes normal people, they think their injury is so bad, and then they don't have to go through half of what you have to go through and still come back and be really at a high level of physical and technique. And so hats off.
Oh, thank you. It's a very long process.
Yes, I know. And it's unbelievably admirable, to go, and also that your mom supported you the whole way through. I think it's really wonderful.
Yes, I'm very thankful for her. And it was kind of nice that it happened to be during the pandemic because I wasn't really missing out on like performing, I guess, during that time. So everything happens. The timing worked out, I guess, even though, of course, I didn't want to be injured.
Do you find, with going back to point shoes, did you wear the same kind of shoes before your injury as you wear now after your injury?
Yes, I do. I still wear freeze.
So point shoes were never an issue for you. Once you found the shoes that were good for
Mhm.
you, you stayed with them.
Yes,
Yeah.
I think I've been wearing the same type of shoe for like almost the whole time I've been on point.
I think
I
that
would
was
say.
like you went through two or three other brands of point shoes before
Yeah.
she found the one for her.
Well, that's wonderful because a lot of people still have trouble finding their shoe that's, that makes their foot feel like part of them.
Yes.
'Cause
Yes,
that's
I love
if
my
you don't have good
shoes.
shoes, your feet feel like they don't belong to you. They feel like they're somehow out. And it's nice when you have a shoe that makes you feel like you can work your feet with no bones in them.
Yes, boneless.
Now getting to 4-point, what do
Yeah.
you feel 4-point, what was your experience with 4-point and what has it done for you?
Oh, lots of things. Yes. Well, when we first started, we were working on building my strength back. So it was kind of nice because I could start with you learning from the beginning almost in a way. So I was things that I weren't do was like the things was doing incorrectly, I was able to fix. Like for example, my échappés, I used to jump them and now I really feel the floor and I feel like my articulation feels like I really feel the position of rolling through.
How do you feel? What did it do for your confidence after having such a serious injury?
It definitely helped my confidence a lot. During our classes, I felt like I built confidence in lots of different areas. And like for example, my hops on point, like I don't think I would have had the confidence if I wasn't doing 4-point with you.
I do think she definitely had some hesitation at first before she started working with you. And so I think I came in like maybe like a couple sessions in because I hadn't like met you yet. And
Oh yeah,
yeah, and I could already see that her confidence, she wasn't as hesitant to do, things that were making her uncomfortable. And I was able to see.
I can still remember in the very beginning when I think about today, even she has a bad foot and I asked her to do 16 plie relevés and 16 relevés without plie. And she did them not only beautifully, but with such an ease that and I can remember the first time I asked her, she gave me a look like, and then, okay, well, maybe we start with 8. And just barely get through the 8. And so back, I'm like, the progress has been tremendous. And it has been such a wonderful experience for me too, because when you see someone like that gain confidence and grow and get better and find themselves again after such a bad injury, it's really a wonderful feeling. So I've been really happy to be part of her rehab.
I'm
Oh,
so thankful for you because I do think if you don't have like once you leave PT, I think it's hard to just go back into the studio and go to class, and they don't necessarily have time to have you. So it's nice to have that time on her own, work on the things that she needs to work on.
yes, definitely.
And do you feel that the work with 4-point has helped you then carry through into your normal point class?
Yes, absolutely. Every time I take class, I feel a difference. Like the things that we work on, I feel it. Wow, I can feel the difference and I can see the difference.
And I think that by working with you, she has learned to use maybe different muscles than she was, or she hadn't developed those muscles, and I think that has really helped her feel, speaking for you, but more stable and confident about her movements.
Maddie, do you have a favorite 4-point exercise?
I have a lot of them.
Everybody,
I love our échappé side to side one.
okay. And
Yes.
one?
I love our reed pipes one.
Okay.
Yes, I love the music too from that one.
So,
And I love all the échappé ones.
Cool. So you would say that your experience with 4-point has been a positive one.
Yes, definitely.
For
And
sure.
could you say in your own words as a student, and then Susan as a mom, what you feel in comparison to 4-point is lacking in normal point training?
Oh,
Oh.
I wish that everybody could start point this way with
Yes.
you, like your program, what
Yes.
you do.
Like when I am older and I have a child and I hope she wants to do ballet, I would want her to do 4-point. Like I would want her to start that way because I feel like she would do everything correctly. Like it wouldn't be like any error, I guess. I feel like there's a lot of missing. Like we do a lot of 3/4 point with you, and I feel like I don't feel like if I wasn't doing that, I would be able to feel that or have like the stability in my ankles. Like when we do like banana, I feel like I don't do that in my normal classes. So how am I supposed to hop if I don't have that like muscle memory of my foot being in that shape?
Yeah. Well, cool. I'm glad that you like 4-point, and I'm really
Oh, I love it. Yes.
and
I
that-
always look forward to our time together.
yeah, me too. And I'm really glad that 4-point and me especially have been able to help you. And I want to thank you for this. And I'm gonna keep my fingers crossed for Sunday.
Oh, thank you.
I'm so thankful for you, and I can't even put words around it. It's just truly remarkable, and I feel like it's going to serve her well, far into the future.
Oh yes,
having
she
had
will
time.
never lose it. She has developed muscles that few people have.
Thank you.
It won't go away.
Yeah, it's interesting because since when we started, since I was coming from rehabbing, and there was very little muscle on my foot, and now you can really see it all, and even in my foot, because like when I first started, my calf muscle, when I got out of my boot, it was so tiny, and so the strength came back quickly, I feel.
But even look at today, your foot is taped up, your foot is injured. You've been off for a few days, but still you had the confidence to try everything in class. Okay, we did a gentler class today, not to strain anything before Sunday, but still you weren't afraid to try things. You weren't like, oh no, I can't. And you just went for it. And that shows that you have an understanding of your body and how far it can go. And that's very, very important.
Yes, I think today gave me confidence a little bit because this weekend I was like, I'm not going to be able to do the audition. I feel like I wasn't going to feel good, and then today I feel a lot better. Like I can do, like even though it's still bothering me, I feel like I'll have confidence for Sunday to do it.
Good, that's important. All right, well then I thank you for this interview. I'm going to end the recording now. Thank you both.
Thank you.
Thank you.
Bye.
Bye.